So tonight we have Ann. She's a LMT and also OTR, is nationally certified and a licensed massage therapist and owner of Compassionate Touch, as well as a registered occupational therapist. For 28 years now, Ann has worked with many people of all ages in faculty care who have physical and congenital disabilities. Her experiences include administrative positions in rehabilitation and long-term care settings. She has enjoyed teaching throughout her career and began conducting Compassionate Touch workshops in 2001. Ann lives in Springfield, Missouri, where she is the owner of Center for Compassionate Touch, LLC, the organization that provides Compassionate Touch training. She has also she also has a massage practice serving elders in faculty care and is a hospice volunteer too. So, welcome tonight, Ann.
Thanks, Ryan.
Yeah.
Thanks for having me.
Yeah. So, actually, technical difficulties are fine because, again, it's live and those kind of things can happen. So, and your Skype is. Yep.
It's a good way to learn how to function these things, right?
Yep, exactly. And your Skype is a little bit locked up, so you might need to refresh it.
Okay.
Yep.
Can you cue me what I need to do?
No. If it was a Mac, I'd know what to do. Otherwise, just click off of sharing with the video and then click it on again. Otherwise, what we can do is we can go to the first slide here.
Okay.
Would that work for you?
That's fine. Did you get the questions okay?
Yep, got them. And I understand massage is not your first career. What actually led you to massage, would you say?
Well, first career in my background is as an occupational therapist, like you mentioned. And a lot of the time during those 25 years that I was working in that field, I had a lot of experiences learning about the lives of people who suffered life-changing disease and illness like stroke, Alzheimer's disease, or traumatic brain injury. And I really learned through that experience that all of those people that I worked with actually were my teachers. And I think they are the first ones who taught me about the importance of presence and the importance of touch in having that relationship with the people we work with. So when I was still working as an OT, I actually was teaching some classes in a massage school here locally in Springfield and had an opportunity to enroll, not really knowing what I was going to do with a massage career, but I knew that it might open some new doors for me. So I went ahead and enrolled in massage school, and it was then that I discovered this approach called Compassionate Touch.
And did you get any training at all in massage school with this, or was it something you had to get extra training in?
It was extra training. In massage school, I think we had, like many massage schools have, it's just a very brief introduction to working with geriatrics and people in facilities. And the school I went to, we actually had an opportunity to go to a nursing home for a couple of sessions, you know, to visit that environment. And it clearly is an environment that I'm really comfortable with. So one of the things that I discovered while I was in school was this approach called Compassionate Touch. And I actually found a book on the shelf in the library. The name of the book was Compassionate Touch. It was written by the founder, who's Don Nelson. And I opened that book and I realized that, you know, I could continue to work with all of the same population that I've worked with for 25 years, but just in a much different way, using massage and touch as a way to, you know, bring about more quality to their lives. So in school, we just really had a very brief introduction to it.
And why do you think that is, that most schools don't have a lot of education in that area?
You know, what I've noticed is that it's kind of all over the board. Some schools provide, you know, quite a number of hours, maybe like where I went, I think we got probably more of an introduction than some other schools might provide. But I think, you know, schools are having to be pretty, to set their priorities about how they use their time and what things they want to provide in the curriculum. But I think one of the reasons why it's not focused so much upon is that it just hasn't been something that massage therapists have expressed a great interest in pursuing in their careers. But I'm really seeing that beginning to change as massage therapists become more familiar with how working with elders in facility care or people in hospice can be a very viable part of their practice.
So would you classify this different than like geriatric massage or elder care? Or is it kind of a part of it then?
Well, I kind of like to think of it as massage and working with people in later life stages. And that can be an elder, you know, an older adult, or it could even be someone who is in their younger years but is in a later stage of that person's life. For example, in the hospice work that I was doing, I actually had a hospice patient who was 2 weeks old. And she certainly was in the later stage of her life. And so it's not really just working with the geriatric population, but it's working with people of any age who's, you know, living with a life-limiting illness or a disability.
But most people think of it as like a geriatric and like hospice care usually, right? Yeah,
I think a lot of people sort of think first about the term geriatric massage, and I'm actually liking to shift. I'm trying to shift away from that terminology a little bit, because in the long-term care and hospice sectors, who are our potential employers, they're really beginning to adopt some newer language. And so in Compassionate Touch, we've really adopted the term elder in replacing that, replacing the geriatric terminology with our elders or our elders. Just has a very different vibration to it when you think about that.
And it gives more of a respect ring, I would say, too.
Mm-hmm,
yeah, because I joke around with people that are older than me. I always say that I always respect their elders and stuff. So, yeah. but technically, but one thing is, I mean, with the geriatric population, that's my favorite population. I mean, it's not some people's, but I myself, for many years before I got involved into massage, I worked in nursing homes, group homes, those kind of areas, and it just, I love hearing their stories. I just love it.
Yeah, I do too, and you know, in my own practice and with the people that I've had the pleasure of training, you know, I think a lot of us who work with older adults feel like we reap more rewards almost than they do, you know, because of that mutual benefit, and it's just really rewarding to listen to what they have to say and to, like you said, hear their stories. But the other thing I notice about people when they are in those very later life stages, it seems like some of the human ego sort of falls away a little bit, and so they're able to really kind of let their essence shine through that a little bit more. And I think there's a real purity that comes about, and being able to see people's, you know, their spirit just a little bit more than in their younger years.
Yep. And you say that there is a growing opportunity for massage therapists to work in elder care and hospice. What is influencing the growth, would you say, right now?
Oh gosh, there's a lot of interesting trends that are happening, kind of all at the same time. You know, I've been teaching Compassionate Touch for about 10 years now, and even just in the last, 3 years, I would say, I'm noticing some real positive things happening with regards to massage therapists actually being paid for the work in elder care and hospice. But what's happening in terms of trends, and I think if you have access to those slides, Ryan, do you have access to those?
Yep.
It's the third slide.
Third slide, okay.
Mm-hmm. You know, it's no secret that the fastest growing segment of our population are older adults. You know, you can't pick up a magazine or turn on the television without hearing about the aging baby boomers. And that's part of what's driving the trend or driving the acceptance of massage therapy in working with older adults, because that segment of our population understands massage and they understand what it can do for self-care and well-being. But one of the interesting things is that the fastest growing segment of our population are people who are 85 years and older. It's not 65, but it's 85. And it's been said that about 69% of older adults at some point will need long-term care services, even if it's just for temporary rehabilitation or temporary stays. And you put those numbers together, and we're looking at just a very large number of people who are needing care services. One of the other things that's happening is older adults are turning to massage therapy more than ever before. And so not only do we have growing numbers of older adults and people who are in those very elder years, 85 and older, but we also have that same population turning to massage in greater numbers. And I hear a lot from massage therapists who come to our training say that they see a lot of people, you know, over 65 who come to their offices, to their studios to receive massage. And my hope is that with proper training and with the right skill sets, that those therapists can continue to follow those same clients as things change for them and if they do develop some of these more debilitating conditions. One of the other trends that I find really exciting that I think probably a lot of massage therapists do not know about is a trend that has to do with something called person-centered care. And what that is talking about is long-term care facilities are more and more adopting practices that give the elders who live in those nursing homes more personal choice, that the facilities are moving away from kind of a hospital environment like the traditional nursing home to more of a home-like environment. And person-centered care also is about fostering relationships with the care staff. So it's really decreasing that institutional feel and giving people more personal choice. And I think because of that, elder care facilities and hospices too are really looking to including some complementary modalities and some innovative programming, and we can certainly be a part of that.
Is that mandated by Medicare then?
Actually, it's interesting. I just attended a conference in Ohio that was a Long-Term Care Association conference. And one of the sessions I went to, actually October 1st, just a couple weeks ago, Medicare has changed some of their regulations to include that facilities, that long-term care facilities, must now demonstrate greater involvement in person-centered care. So yes, it is being it's now part of the standard regulations from Medicare. So that's kind of exciting because facilities and hospices too are going to be looking at innovative ways to meet those regulations.
But it's just really shocking to me. I mean, age 55 and over is the fastest segment of population. That's just, I mean, the average person doesn't think about. I mean, most people think they're going to maybe live to 70, maybe 80 at the most and stuff, but to 85 plus, I mean, that's just... Did that kind of shock you too when you read those stats? And
yeah, it is, and that's no longer in the future. You know, when I started working in healthcare, you know, those numbers and those figures were kind of talked about, but they were always kind of in the future. It's no longer the future, it's now. And that's not just in the United States. I think China, actually, and some of the Asian countries actually have even higher statistics in terms of the numbers of people living into those very, you know, older years of 85 plus. So it's really a worldwide trend, not just in the Western world.
Isn't our population in the United States known to live long? Do we have the oldest population, would you say, or do other cultures beat us in those areas? Do you know?
Well, I'm not an expert on the trends, you know, and those numbers, but from the things that I have read about that, the trend towards living longer is really a worldwide trend, especially in developed countries. Not so much in underdeveloped countries or third world countries, but in the developed world, and that is something that we have in common with other cultures.
Okay. And how do therapists actually get paid for this work?
Well, that's an interesting question. You know, one of the things that we've really seen, and I'm very delighted about this, is that, you know, when I started teaching compassionate touch, I remember a lot of people really expressing this idea that, the idea was something like this. In order for me to work in hospice or to work in nursing homes, the assumption is I have to volunteer my services. And that simply is no longer true. And we're working very hard to really decrease the numbers of people who are volunteering their services. And the reason is because hospices and long-term care facilities are more than ever before bringing massage therapists on board either as employees or as independent contractors. And one of the things that I've noticed too, when people contact me about wanting to inquire about our training, a lot of people are coming, not a lot, but more people are coming to Compassionate Touch training having already secured a job in elder care hospice. So they get the job and then they think, oh, I better have some specialized training. And in some of those cases, the employer is actually paying for the training. So that's something that I'm beginning to see more of. But in terms of how people are getting paid, that's happening in many different ways. Actually, there is a slide if you want to pull this one up, Ryan. It's number 8.
8, okay.
Yeah.
Got it.
It just kind of addresses this issue. But a few months ago, I worked with Massage Today magazine, and we did a survey. And about 250 people responded to this survey. And what I wanted to find out was how many people who are working in elder care and hospice are doing it either as an employee or as a independent contractor. And of those 250 people that responded, about 59% were working in elder care, and about 41% were working in hospice. And of those, about 34% were employees, and 51% were independent contractors. There were some others who responded because they were volunteers. So the good news is that more people are being brought on as employees and independent contractors both. And that's really consistent with what we're seeing too as we talk with our practitioners, we talk with people who are out there doing this work. So, you know, it's like we like to say in compassionate touch training, we tell our practitioners, the good news is you're a pioneer because you get to help create this thing. The bad news is you're a pioneer, and is that there's really no standard way that is coming about. But one thing that we do see is that all around the country, from Florida to the Northeast to the Northwest and the Midwest, there's a consistency in terms of the growing trend of massage therapists actually being hired for work in these settings. So it's a very exciting time, given all those trends that are happening, and given the place where we are with being able to provide specialized services to those settings. So the two worlds are sort of coming together, and we're working really hard to bridge that, you know, so that therapists who want to do this work can really go out and do it and get paid for it.
Would you say the pay is kind of similar what therapists are making out in the field, or do you think it's more or less? Or have you run any surveys like that at all?
A little bit. Actually have recently written an article trying to address that issue, and I've talked to several practitioners who are doing the work. Some are in hospice, some are in elder care, some are employees, some are independent contractors, and there tends to be a bit of a range. You know, it is. I don't know if you can really compare it directly with massage in a regular practice because the scale's a little bit different. But what we're seeing is that I can give you a couple examples. That's probably the best way to say that. One example is a massage therapist working for a hospice reported that I think her salary range was right around $28 an hour, but then she had full benefits. And then there's another gal that is working in a long-term care facility full-time, and her salary was somewhere around $45,000 plus benefits. And then we talked to others that it's lower than that. So, you know, I think facilities are finding ways to bring therapists on board. And sometimes they're converting an existing position, like in the nursing department or the rehab department or the activities department, because they're having to sort of create this, you know, without having had massage therapy programs in the past. So it's sort of happening in many, many different ways.
And I remember back in the day when I worked in the nursing home, I also was a massage therapist part-time, but they paid me a nursing assistant salary during that time then. So that's the way they got around with it without paying me separate. So
yeah, I see that kind of thing happening sometimes too.
Yep. And then somebody, there's a couple different questions I have to ask you. How does she feel about the different states having different hour requirements? Like New York has 1,000 hours compared to Florida, around 500 or so. I mean, with your kind of care, does somebody need to have like a full massage diploma at least, like 500 hours? Is there a certain limit for requirements?
You mean to go into an area of specialization like compassionate touch?
Yeah.
Yeah. Well, I think it's important, you know, we do require for our certified practitioners, we do have a certification program. And I think it's important that in whatever state you're in, you know, that you have completed the requirements there. And I understand, you know, from state to state it varies quite a bit, and we're beginning to do a little bit of work in Canada, and it varies even more there. So I don't really have a strong feeling about, you know, 500 versus 1,000. What I have a stronger feeling about is I do think it's really important for massage therapists who want to do this kind of work with a special population, that having specialized training and having a way to develop those special skill sets is what's very important, because it's just a whole different set of skills that's required beyond the basic massage curriculum. There is a slide, Ryan, it's slide 5.
Okay.
That kind of fits in with what I was just saying.
Okay, so be informed kind of things?
Yeah. Some of the things that I think are really necessary, if somebody wants to do this work, they need to be familiar with age-related changes and familiar with some of the common conditions that you would be faced with your clientele in elder care and hospice. Things like Alzheimer's disease, Parkinson's disease, some of the other illnesses, cancer being common in hospice care. But also the unique needs, the psychological needs, the emotional needs, and just what people go through when they have to enter long-term care. That's a very important thing to sort of have a grasp of, so you can be more compassionate and have an understanding. Of course, the benefits, the specific benefits of touch and massage for that population, but then how to navigate the system. And what I mean by that is, you can be really comfortable with working with older adults or hospice, have experience, maybe have personal experience, comfortable with going into the nursing home, all of that. But if you don't understand how to promote your services to those settings, it seems like that can create a barrier, because we have to speak their language. We have to understand that these are businesses, they're healthcare organizations, and we have to be able to communicate effectively what we can offer them. And that's where I see the gap oftentimes being, and that's part of what we work very hard to empower therapists to be able to not only provide the direct care of their clients, but to be able to be a part of those healthcare settings and to be effective in promoting their services there.
And one question I want to ask is, when you go into a nursing home and those kind of places, sometimes you don't have the rights to look at their files. So,
yeah.
And what if somebody really can't communicate with you, or let's say a family member set up the massage for you? How would you go about finding out what to do and what not to do then?
Yeah, and especially these days, since the privacy laws have gotten more stringent with the HIPAA regulations and those kinds of things. But the guideline that I would say regarding that is, it kind of depends on what your relationship with the facility is. So, if, for example, if you've just been asked by, say, a friend, a family friend to come in and see their mother, and you're going into the facility to see that one person, you're really a guest in that facility. You don't have a formal relationship with that particular organization. So in that case, you probably would not get very far trying to get information about that person's condition from the facility. You'd probably need to get it from that family who referred you to see that person. But if you're going into a facility because the facility has contracted with you, that's a whole different story. And now you have a formal relationship with the facility. And, I always encourage my students that that's something you understand up front, that you need access to that information in order to provide safe and effective care. And as a healthcare practitioner, which we are, as massage therapists, yep. There's nothing in those privacy laws that prohibit us from having that. So the guideline is what your relationship with the facility is.
Okay, so that definitely helps because, again, sometimes back in the day when I worked in nursing homes, sometimes they wouldn't even tell us what people had. Even if, let's say, they had something contagious, they would just put something on the door saying, "Go meet with the nurse beforehand," kind of thing, and they wouldn't even specify. And so
that's still the case.
Yeah.
You still see that sign, and it's because of the privacy laws. They really can't give any information on those signs. So I always tell people, if you walked up to the door and that sign is there, then that's exactly what you do. You go check with the nurse before you come in.
And do you train other people besides massage therapists for this, like nurses? Because technically, aren't nurses underneath? They can actually perform some massage in these kind of facilities. And
yeah, in our basic workshop, which is we call it just our level 1 workshop, we often have other healthcare practitioners attend that, and I think that's great. We often have activities, professionals, nurses, sometimes social workers. I've had chaplains attend, and the distinction I like to make is, anyone can use touch in a more purposeful way, but I'm not going to probably encourage a social worker to go try to do a back massage for somebody. But within the scope of what those health practitioners are doing, they certainly can utilize the concepts of compassionate touch and use touch in a much more conscious way to, within the scope of what they're doing. So quite often we do have other professionals attend the training. Our certification for practitioners primarily is licensed massage therapists. Occasionally we might have a nurse become certified or someone else who already has that, quote, license to touch. That's the key for really doing the full scope of compassionate touch services.
And kind of the trend now, it seems that they're trying to limit the nursing home beds now. Would you say they're trying to get more like in-home health care or more like assisted living kind of facilities? Do you see a trend of that happening more in the future too?
I think we're going to see an increase in all levels of care, from independent senior housing, assisted living, home health care, residential care, and hospice. So I think there's going to be an increase in all of those things. And I think it's great, more and more people, it reminds me of something that I think was surprising to me when I heard this. It was that about 70% of older adults live at home. And so it's only a small percentage of people who require the services of a nursing home or assisted living facility. I don't know, I think there's this sort of assumption that a lot of us have that, when you get old, you're going to go to the nursing home, but that just is not true for most people. And so I think home health care really has a strong place, and I think that probably will continue to grow, as well as long-term care.
And do you see with in-home health care, do you see therapists more going into nursing homes or assisted livings or in people's houses then? Which area do you see more the benefit? After a few years down the road, where do you think more the need would be for your type of therapist?
All of it.
Come on, that's too easy.
All of it. That's my short answer. And how many therapists do you have right now that are certified with compassionate touch? Well, for our certified practitioners, we're probably approaching probably close to 150 or so. But over the last 9 or 10 years since I've been teaching, I think we're probably looking at close to about 500 people or so who have attended some form of compassionate touch training. So, we're working really hard to not only increase those numbers, but to work with people who are on the other side of the desk, you might say, are potential employers. I have the privilege of being able to speak to nursing home administrators and other decision makers at long-term care conferences and hospice conferences and that kind of thing. And the reason I'm doing that is to educate, those potential employers and to educate those decision makers in terms of the value of massage. And by doing that, hopefully bridge the gap between the services that we can provide and their willingness to let us do our work there. So, like I said, it's an exciting time.
And then somebody asked online, how do you get certified in it? Do you have to go through so many levels before you get that certification, or what is your process?
Sure. There are basically currently two levels of training. The first level is our basic workshop, and it's a 20-hour weekend workshop. It's 2.5 days, and that forms the foundation for our certified practitioner training, which is a 35-hour intensive. It's a 4-day training, and so upon completion of that second level, we award the therapist with the certification. So our certified practitioners have had 55 hours of compassionate touch training, and the focus of the training spans not just elder care and nursing home, but also hospice. So that's basically what our program entails.
And where do you host the workshops usually?
Well, that's one unique thing about compassionate touch training. We have all of our live training courses on site in long-term care facilities. So we're actually collaborating with nursing homes or continuing care communities, and they serve as our host training sites. So wherever we offer the training, we're doing that actually on site. And part of the workshop is the therapist actually having compassionate touch sessions with elders in the facility. So that's a model that we adopted a few years ago, and very committed to that model because, when I first started teaching, I did a workshop in some other settings like massage schools and that kind of thing. It's a very different workshop. And I think the value of going on site and actually being in the environment and actually working with the elders as part of the workshop is just very, very valuable. So we'll continue to offer the training in that way.
So these are nationally board certification too, so that people can use them for continuing education credits?
Yeah.
Okay.
Yeah, the Center for Compassionate Touch is an approved provider nationally and also in the state of Florida.
So do you travel much with your workshops then? All over the United States, all over the world yet?
Not the world yet, but
that will happen.
Yeah, we're looking forward to expanding beyond our borders. But what we've done is selected regions of the country and kind of expanded the training regionally. But we're getting ready to enter a new phase, and this is kind of if you think about the question of what's next, for our work with the Center for Compassionate Touch, one of those things is we're getting ready this November to have our first teacher training program. And so basically what that will involve is we're training some other practitioners who are going to be certified to teach the basic workshop. So by doing that, we're going to be able to expand our regions, to offer more workshops, to reach more people, and ultimately provide more of these services to the people who need the work. And that's our elders and people in hospice. So it's a very exciting step for us, and looking forward to seeing what that does in terms of the future.
And who's going to all be at the conference then?
Well, we have 12 of our certified practitioners who are going to be joining us, and we're having the teacher training. It's in Florida in November, and we'll be able to announce that further as time goes on in terms of who those folks are. We're not quite ready to do that yet, but looking forward to having them on board as part of our team.
Well, I think you picked a great month for Florida, though. So.
I think so too.
Yeah. Because remember, in July we're in Florida for the Florida State Massage Therapy Association, and I didn't want to go outside during that time. Yeah. That's probably why the trade show area was so busy, because nobody wanted to go outside. And
yeah, we'll be back down there in January too. So
okay.
not totally by accident that we chose those times.
Yep. And is there a lot of research on with the elderly population with massage?
Yeah, if you want to put up slide number 7.
Okay.
Just wanted to say that, you know, there is a growing body of research, and especially around 2 areas that we're especially interested in with compassionate touch. And one of those areas has to do with massage as a non-pharmacological approach for pain relief, pain management, which is a huge issue in hospice care especially. And so the research appears not only in the massage journals and massage publications, but quite a bit of substantiating research in nursing journals and palliative care publications. And one of the things that I wanted to mention about the research supporting us in our work with pain management is that it's showing more and more that you know, pain isn't just a physical experience, and so we know what massage can do for alleviating, you know, the physical sensation of pain, but we also know how much touch can help to alleviate anxiety related to pain, can alleviate the person's perception of his or her pain. And so we have a lot to offer with regards to non-pharmacological approaches for pain management. And one of the things that I think some of the massage therapists may not understand is that long-term care and hospices both are mandated by Medicare to be able to document that they are using or they are attempting non-pharmacological approaches for pain management. So we can really be an answer to that that problem that they have, to be able to use some complementary or some alternative ways of managing pain other than medication. The other body of research that I'm particularly interested in, because I really love working with people with Alzheimer's disease and see a lot of profound impact that we can offer using touch and massage for that population. And there also is a growing body of evidence through the research showing that massage can be a very effective tool in managing challenging behaviors and decreasing agitation, which is a real problem in long-term care settings of how to you know, manage these behaviors and have an impact on that. One of the studies, for example, that that I came upon, it talks about just simple hand massage and how that can have a positive impact on decreasing agitation. And what they found was that even a 5-minute hand massage prior to, like, the nurse assistant going in to do morning care routines, helping the person get dressed or bathing, that kind of thing, that it helped that person, that nurse assistant, to be able to perform those tasks with greater ease without the person being triggered into agitated behaviors. And that was a simple 5-minute hand massage. So we're seeing more and more of those kinds of studies show up in the literature that really document what we have to offer. One other thing I wanted to just mention, I think it's on the slide, in 2009, the American Massage Therapy Association approved a position statement about the use of massage in hospice and palliative care, and I think that is really a very important step for us as a profession to be able to point to that as to show our potential employers that it's not just us saying that we are effective. It's other studies being borne out, and they're appearing in other professional journals.
And I see in the picture there too that people are giving massages in wheelchairs. How common is that with this type of massage?
It's very common. If you think about the people that you see in those pictures there on the slide, those women would not be able to get up onto your massage table to receive a massage. So that's one of the unique things I think about this work, is that it falls upon how we approach people. And so in Compassionate Touch, one of our basic foundational concepts is that we're meeting people where they are. And so that means, we're working with people in wheelchairs and hospital beds and other kinds of chairs. Sometimes working with people while they're walking, So it's part of the specialized approach to be able to work with these people in a way that we're not requiring them to change in order to meet our requirements, but we're changing to meet theirs.
So do you really stress a lot with body mechanics for the therapist? Because I myself, when I've tried to massage people in their hospital beds and nursing home beds, it's a pain.
Literally.
Yeah.
Literally, yes.
Yeah, so you need a massage after that, no?
No, we do, and that's a real valid point, So a lot of people think, well, this is lighter work and it's be easier on my body, and that's true in some ways. In fact, that's one of the reasons why people sometimes seek out this work. But body mechanics is always a factor, so it doesn't matter if the person's in a wheelchair, you're doing a seated massage, working in a hospital bed. Yeah, we do incorporate body mechanics. It's always important, no matter if it's a light massage or deep tissue. So it's always a factor.
Yeah. And you guys believe in using any adaptive equipment, like certain pillows, or the body cushion, or anything else like that?
Well, I always like to be as low-tech as I possibly can be. So when it comes to special equipment in this work, really we're not using a lot of special equipment. We're using really what the person has in their own rooms, because of, especially in nursing homes, but hospice too, because of infection control issues and that we want to really minimize the amount of equipment that we're taking in and out of the facility. So we're really using things that are there, pillows, towels, blankets, that kind of thing, for comfort positioning, and not a whole lot of specialized equipment.
And then what about your new touch kits with Massage Warehouse now?
Yeah, we're getting ready to, well, we have actually, it just came out. Massage Warehouse, along with the Center for Compassionate Touch and Bon Vital, we have put together 2 touch kits. One is a caregiver essential massage kit, and one is a professional level one. And basically what it is we've selected items that any healthcare practitioner or massage therapist or even a family caregiver perhaps can use to support you in your work in providing massage or skilled touch for people in these settings. So the kits consist of some items that we've specially selected, including some aromatherapy oils, some lotion, foot balm, some, I don't have the list right in front of me, so I'm kind of blocking on the other things. There also is an instructional DVD as part of the kit that I actually created a couple years ago, showing some hands-on techniques. So we just selected a selection of things that someone, you might think of it as that you would want in your bag, you know, as you went into a facility. Because over the years, it's been one of the questions that a lot of massage therapists have asked, well, what equipment, what materials do I need? What's safe to use with this population? And those kinds of questions. So we're attempting to take the guesswork out of it a little bit for them and provide them with a basic selection of things that they can easily obtain and take in with them to support them in their work.
And Lisa's getting the touch right. The link right now for Massage Warehouse. So.
Oh, good. Thanks.
Oh, and here she has all the things that include the Bon Vital Natural Massage Lotion, 8 ounces, Senna Hands, Anachromial Hand Wipes, 150 count, Reunion CD by George. I can never pronounce his name right. Messenger Bag, black. Backless on site, therapist stool, sensitive massage DVD, instructional guide, Bon Vital foot balm, 3.38 ounce tube, Lotus Touch, lavender essential oil, also sweet orange and rosemary. So
right.
Yeah, that's an awesome start. I mean, and that stuff's small enough that you can just throw in that bag too. So
there's two things I want to mention about that. The stool, that, you know, having a folding stool is something that you'd mentioned body mechanics earlier.
Yep.
That is going to be the massage therapist's best friend going into a facility, because there often isn't a chair, an extra chair to sit on. There's, you know, oftentimes nothing but the bed. So if you have a folding stool, you always have a place to sit to work with somebody in a wheelchair or bedside. So that's a very important item. The other thing I wanted to mention, in our professional kit, we have included a tabletop massager. Basically, it is a piece of equipment that sits on a table and a person can lean forward to be supported while receiving a seated massage. And that is something that we're very excited about, because a lot of times therapists who work in facilities or in hospices are not only working with the elders or the patients, but they're also working with staff. And so that can be a very nice piece of equipment to do staff massage, and also to work with some of the clients and family members. So I think that's something that people are going to really get a lot of use of too from the kit.
And I myself too, that's how I started massaging in the nursing home, was I started working on employees, because their backs, they horrible backs because of all the lifting and twisting and turning, and so, and then eventually they saw how beneficial it was, and then we started massaging residents. So it it was a great thing. So
it's a real win-win. You know, I think anyone who's working at all in elder care and hospice really should reach out to the staff and provide some massage for them, because they quickly will become your best friend, and when that happens, they'll start referring.
And another thing I mentioned too to the residents, that they don't have a lot of things in their rooms, and what's really beneficial to have massage, so you can so you can recommend them to even pay for massage outside of, or even tell their relatives to get the massages too. So
yeah, I think probably a very high percentage of people who are referrals for the residents in a long-term care facility and hospice too. A lot of times those referrals do come from family members. Staff too, but it's oftentimes the family who's actually paying for the service and providing that for their loved ones. So I think that's something else that's really unique about working in these settings. And if you want to pull up slide number 6.
Okay.
One of the things that's really different is has to do with the fact that you don't just have one client. You know, if you have just a regular practice and you have people coming in to see you, you have like one client, and that's the person that you're actually massaging. But when you're working in elder care and hospice, you really have 3 at least. You have, of course, the person that you're massaging, which is the individual, but you also have the organization, because that's your referral source, and it also is probably, well, it might be the person who's paying you for the service. But then oftentimes you also have the family as a client, because they sometimes are the one who has referred or has contracted you to see their loved one. And what we find is many times, you know, we're interacting with the families. Sometimes we're providing massage for the families. In hospice care, if you're doing home care, you know, you go into someone's home, there's family present. So it's very different in terms of who your client is when you're doing this kind of work. And most of the time, you're really expected to really be part of the team and interact with the other staff and be a part of the organization.
And I would say sometimes the family members need it more than the actual client or the resident, because they sometimes have a hard time with that person. Eventually they might die, kind of thing, and it's just the whole transition. Would you say that's?
Yeah, that's especially true in hospice care, and especially, you know, as the person really begins to enter the final stage of life. Oftentimes the attention really does shift to more of the family or those other caregivers. And that's true of the hospice team. You know, in hospice care, the patient, so to speak, is actually considered to be the person who has the illness and the family unit. So it's really, the patient is really all of those people involved. And so a lot of times you're right that our services or our attention includes not only the patient, but the family as well. So it's very typical that we'll find ourselves, you know, providing some massage or providing a listening ear, you know, and being there for the family too.
And how long is the average massage, would you say, for somebody in hospice care or nursing home setting?
I think, you know, it fluctuates a lot, but average, we like to kind of think of it in terms of about 30-ish minutes.
Okay.
You know, one day you might go and the person tolerates 40 minutes. The next time you go, maybe it's 15. It, you know, it kind of depends on what's happening with that person's condition, what's happening with their day, and that kind of thing. But on average, most of the time, it's around 30 to 40 minutes.
Okay. So do you think an hour plus kind of thing might be too much for the body, or?
Yeah, rarely in this special population would you be doing hour-long massages. Okay.
And then I heard a little rumor that you might be at a certain conference next year.
I am. Who told you that?
Because I'm making the video right now, so that's why.
Oh, okay. Actually, I really am very honored to be a participant in the conference next May 2011. And, you know, I really mean that, too. I feel very honored that I'm going to be participating in the very first American Massage Conference. My session is going to be a 3-hour workshop on massage and elder care and hospice, an introduction to compassionate touch. And I think anyone who's maybe thinking about working with this population, or even already is and wants to come and learn some new things or affirm what they already know, be a great session for people to attend. Really looking forward to participating. I think it's going to be a great event.
Yes, definitely. And everybody needs to at least get a piece of this kind of this style of massage. I mean, this population, because again, I mean, with the baby boomers coming up, I mean, it's just going to be a lot of business for us. Would you say?
Well, that's true, and you know, I think just things are really coming together to make for a bright future for those of us who really like to work with this population.
Yep. And what is actually next for Compassionate Touch?
Well, I mentioned our teacher training, so we're expanding, you know, the number of workshops we'll be able to do, and expanding the work. You mentioned we talked about the touch kit. That's an exciting thing. And I think one of the things that we're hoping to do is to collaborate, do some networking with the massage schools. I think that's also an important step to let students know that this can be a viable part of their practice, and something, you know, that they might want to consider, you know, as they're looking at their options. So there's lots of great things on the horizon for the Center for Compassionate Touch as we continue to expand this work, and look forward to what's next.
And are you going to get more involved into video too then? So I know you have that one video through Massage Warehouse, but are you going to be making other videos too?
Yeah, the video that I currently have available is called Sensitive Massage, Reclaiming the Human Touch and Caregiving. I made that a couple years ago because I wanted to create an instructional video showing some of the hands-on techniques and do an overview of, give an overview of the benefits and precautions and, you know, all of the things involved. I do think there might be another video in the future. I'm really interested in perhaps creating something around the idea of using massage with people who have Alzheimer's disease. So we'll see. I don't have a particular deadline yet, but I think that it's something that I'm really interested in contributing.
And is that a hard population for the average person, would you say to massage?
Somebody with Alzheimer's disease?
Yeah.
Well, I think most people, what I see happening with people who are just beginning to work with this population, there is some fear. You know, there's this fear of, will the person be upset or get confused or get combative or, or I don't know how to interact. I think the communication piece is the thing that causes some anxiety for a lot of massage therapists or a lot of, anybody. And so a big part of our training is to help develop some ways of communicating with people who have dementia, because it takes the fear out of it then. And the massage piece is really, I think, secondary to how we can use touch in a conscious way to relate to the person. And, I talk about what I call sacred moments. And the sacred moment is when something happens in a session that is sort of outside of the normal response that you would expect to see. And in working with people who have dementia, I think we have an opportunity to really witness some pretty profound sacred moments. Thinking of, the woman who is thought to be nonverbal, who at the end of the session looks you straight in the eye and says thank you. Or the person who takes your hands and gives you a hand massage. I've had that happen several times, and I know other practitioners have things like that happen too. And so there's just a lot of very profound things that can happen through the power of touch and working with people with dementia. We have a lot to offer them.
And what was your most gratifying moment working with these type of people?
Oh gosh.
Only pick one or two, okay?
Actually, I do have one slide. Put up slide 9.
Okay.
Just because this woman reminds me of a story, and she's someone that I just think really embodies the response that we sometimes see. Let's see. I'm thinking about one woman who, when I would see her in the hallway, she was oftentimes kind of, she always seemed sort of sad and anxious. She oftentimes would be kind of crying a little bit. She did have dementia, and she could talk, but didn't usually initiate conversation. So one time when I was working with her, I was doing a hand massage, and someone had clearly given her a manicure. She had very long, beautiful fingernails, and I commented on those. And what she started telling me, and her speech was kind of garbled, but I could make out what she was saying to me. She said that she used to bite her fingernails. And I said, really? Your nails are so beautiful now. How did you stop biting your nails? And she started laughing and got this big smile on her face. And she looked at me right in the eyes and she said, I lost my teeth. And she laughed. And what was the sacred moment in that was, of course it was just a hoot, because she was right. She had no teeth. She couldn't bite her fingernails even if she wanted to. But the joy in that woman, and seeing her sense of humor come out, and I saw that with her pretty regularly in our sessions. She was very responsive to touch, loved having her hands massaged, and I would just see her sort of come alive, and shift from this sort of whimpery, whiny, confused person in the hallway to someone who was sort of engaged and laughing and bright. And one thing I noticed was that mood, that uplifted mood that she had, it kind of lasted a little while after our sessions. So I think, the takeaway message that she gave me as one of my teachers was how powerful something simple like a hand massage or just a light back massage, or even just holding somebody's hand, the shift that that can make in that person's day and their quality of life.
Yep. And has there been anything that we haven't covered that we got to make sure that we cover?
Well, let's see. I don't think so, Ryan. I think this feels pretty complete in terms of the points that I was wanting to make. Did you have any other questions?
Oh, honestly, I could speak all night, but just because, again, it's my favorite population. So,
Yeah.
or one thing I want to ask too is, what do you usually use? Do you use lotion? Do you use oil? Do you use cream? Is there any certain types you use?
I discourage people using massage oil in these settings for two reasons. One is a lot of older adults aren't that familiar with it as a substance, you know, to put on the body. The other reason is if you happen to accidentally, you know, drop some or drip, you know, on the floor, it's a real safety hazard, especially if there's a tile floor. Becomes slip. So you create a fall risk for the staff and for the elder. So I suggest massage lotion, and in our touch kit, we've selected one from Bon Vital. It's their natural lotion that is hypoallergenic. And I think unscented is really a wise choice as well, mostly because some people are sensitive to, you know, different scents, and some people, you know, become more sensitive with medications and all these different things. So I think unscented is the way to go. And if you want to add a little essential oil, just do that, you know, like for each application rather than putting it in your bottle.
And then somebody asked, what do you do for yourself to keep yourself healthy?
That is a very no, I mean that very seriously. Yeah. The emotional impact of this work can be pretty striking for people, and I think it really doesn't matter what you do to keep yourself healthy, but it matters that you do something, whether it be you know, just really keeping your body healthy, exercising for stress relief. It's those basic things that we all know. But beyond that, I'm a real proponent of using what I call rituals, whether that be journal writing, whether it be having an altar, whether it be lighting a candle. Because the truth is, in this work, you know, it's possible that you could lose every client that you have. And being prepared and being proactive to acknowledge that reality is really important, because if we don't do that, if we don't let ourselves be real and have feelings about our work and about the people that we see, and when we lose people, it does take a toll on us. And people, there actually is something called compassion fatigue, which is kind of like burnout, but it goes a little bit even further than what we think of as job burnout. And I think all of us in massage therapy and other care professions are at risk for compassion fatigue because of the kind of work we do and the kind of people we are. You know, we're kind of wired to be caregivers, and so I think taking care of our own needs. I think one of the most important things is having a support system. Finding other people who are of like mind and maybe are doing similar kinds of work that you can call, you know, or turn to when you're struggling a little bit, or when you're noticing that, you know, you're starting to feel sort of weighted down, or you just need to share about your work. I think having a support system is really, really smart.
Do you believe in like grounding yourself beforehand, or is there any other kind of things that you do, just so it's, again, sometimes you absorb all that too?
Mm-hmm. I like to think of it as you know, getting yourself very centered before you go in to see someone before a session, and then having a way after the session to sort of clear. You know, and getting centered can be something as simple as just taking a little breath and pausing. Some people might use a visualization. Other people use prayer or an affirmation. And then the after the session, taking a pause and like ending that session before you start the next one. It's really easy, you know, throughout the busyness of our days to go from one to the next, to the next, to the next. And in like a nursing home setting, where you don't really have control of the environment, you know, you don't have your massage room with the candles and the music and the lighting, you know, and the environment in a nursing home can be really chaotic. The environment in a private home can be really chaotic too. You know, there might be dogs and cats and people and all kinds of things. So after a session, finding a way to let that session go and then start the next one really kind of helps to keep you grounded.
Okay. So tonight it's been great. I mean, this is my favorite style, favorite population, and I don't care what other people say. This is this really rings true to my heart, because my grandma right now, the only living older relative right now, has Alzheimer's, and she even asked for massages too. So it's so nice to, even though sometimes they don't remember it, but I mean, touch brings back things. Would you say?
Yeah, it does, and we all have like a sense memory, and touch can be a real trigger of bringing that sense memory of past events or past feelings, you know, back to people who might not have access to those very easily, you know, just in their own memories. So, yeah, I think it's great that you're able to provide that for your grandmother.
Yeah. Okay, so if anybody wants to get a hold of Ann, she has a Facebook fan page. I posted that there, and then also when I finalize this whole video, I'll put the links, so it's going to be direct links. And in about a day or so, that's when I'm going to have the full video up. So if anybody's missed this, that's why you're watching it not live then. So again, look for Ann. So so the website is what again?
The website is www.compassionate-touch.org.
Okay. Okay. And thank you, Ann.
Thank you, Ryan.
Yep.
It's great to see you.
Yep. And sorry about the technical difficulties in the beginning, but it was fun.
It turned out great.
Yep. Okay. Thanks, Ann. Good night.
Thanks so much for having me. Good night, everyone.
Thank you, everybody.